Got it?
Yes.
That is your doubt, no?
Yes, sir.
So here, see, sir, here, you need to show the future consequences they have to face. Got it?
Okay.
Here, ABC model.
Yes, sir.
So here, see ABC model. See, any counseling, any sort of counseling, combination of various techniques. It's not only one technique you have to use. For example,
Okay.
in this case, one technique can use ABC model. What is ABC model? Activated event, behave, that is belief system or consequences. ABC model. A is
Yes.
Yes, sir.
activated event. So here your question is that they won't allow us to discuss about their children. That means acceptance is very low. They won't accept.
Yes.
My child is not like that.
Yes.
Maybe you will get the
Yes.
information from the school authorities. Just you want to confirm this issue from the parents, but they
Yes, sir.
don't accept it. Acceptance is the toughest task. Even educated parents, highly educated professionals, they are expert in their own field,
Yes, sir.
but they are not expert in the psychological field. Yes, sir.
Yes, sir.
So,
Yes.
so here that is the reason we are talking about. In our textbook also it is given. It is the toughest task.
Yes, sir.
Providing counseling to the adolescent people is the toughest task. It's not so easy. It is
Yes,
a
yes,
difficult
sir.
task. Yeah. Here, what to do? So they are not in a position to accept the issue. So just you show the ABC model. ABC model means the reluctant parent. That is, their activity is that their acceptance is low. That is the reason they let the child in their own way.
Okay.
Okay. So here,
Okay, sir.
just their belief system is that, you are talking about my child. I know everything and everything. I am expert in my this field. I am doctor. I am a medical doctor. That is their belief system. They believing that I know each and every aspect. Nothing to worry about my family. No need of giving advice to my child. Got it? That is their belief system. That is the reason they won't accept you. Based on their wrong belief system, their activity is that they won't allow you to involve in the issue.
Okay, sir.
Now,
Sir, can I tell one example, sir?
here you need to show the conflict.
You can alone.
Yeah, please.
Sir, one
One
mother.
second, sir. In this context only, in this case, can we have no access to the parents? Then we have to get the information, best possible information from the teachers and friends and the boy himself, and then give our counseling from the school side. That we can attempt, I think.
Yeah, tell me.
Yeah, that's it. You go ahead with your doubt.
That is one way. PTA, in some case, schools, central schools, parent teacher association, or PTM, parent teacher meeting. So in that PTA or PTM, so with the collaboration, with the consulting of the teachers and the parents, they will get together. That is also one situation you can involve in the issue. You can involve the parent in the PTM or PTA meeting.
Yeah, there we can explain, and then they may be convinced.
Yes. So then another thing is that to show the consequence. So this is the issue now. Your child, if the same behavior is continuing for a long time, what are the consequences they will face? The consequence may be from the child.
Yeah.
Consequences the parents also they need to face. Maybe they are experts in their own field.
Yes.
So those consequences you have to show that. See, one technique here is ABC model. Second is CRT, cognitive restructuring. You need to restructuring your thought process. Third one is visualizing. See, in only one counseling, how many techniques here? One is ABC model you are using. Cognitive restructuring model is technique you are using. Even visualizing. Visualizing means just you think, you visualize, you imagine about your own child after 2 years or 3 years. That is the other technique.
That will be more compelling. And maybe convincing the parents.
Definitely one way or other way. So one more thing I want to explain. Any psychological issue, I want to reassert, any psychological issue, there is a solution. Then how your counseling, how the competencies of the counselor or the psychologist depends on that. So definitely there is a counseling.
Sir, if you can allow me, I will tell one live case.
Sure. Sure, sure.
Uh,
Tell me.
Sir, one mother of 42 years approached a doctor, sir. Okay, and mother was telling
42 years.
my
Her age is, mother's age is 42 years. Yeah, fine.
mother 42
Tell me.
years. She was
Mhm.
complaining that, doctor, my daughter, she is 14 years. She's studying 10th standard. From the past 6 months, she is not at all listening to my words. She is
Past 11
behaving in a
months.
rude way.
Mm-hmm.
She is 14 years, sir. She is studying 10th standard.
Mm-hmm.
From the past
Yeah.
6 months, she is not listening to me. She is not behaving in a normal way. She is
Mm-hmm.
behaving very rudely. Whatever I
Mm-hmm.
tell, she is contradicting me. Like
Mm-hmm.
she is behaving in a different way from the past 6 months only. That
Yeah.
is where mother approached
Mm-hmm.
doctor, and she was telling, please doctor, can you counsel my daughter?
Mm-hmm. Yeah.
So when I talked with the daughter, she was telling, sir, I'm normal. I'm absolutely normal. When a student was telling, I'm absolutely normal. When go on digging from mother's side, as well as I asked her mother to go and inquire in the school, everything happened. At last came to know that mother had conceived and she delivered a girl child 6 months back.
Okay.
Okay, sir. So
Yeah.
so what mother came to know that from the school, that is, this particular daughter, her own daughter, is having one boyfriend in school, and she is trying to torture him, like trying to tell him, trying to blame him, trying to trying to love him, and
Okay.
she wanted him also to love back, and she is literally
Trying to
forcing
blame
him.
that boy.
Yeah, this girl is trying to trap that particular boy, school classmate. If you won't love me, I'll show the chats with your mother.
Yeah, got
This
it. Yeah.
particular girl.
Mm-hmm.
And in the long run, like when we are digging more from the mother side as well as from the school teacher, came to know that mother has delivered one girl child, and this particular girl, from the past 6 months, she was getting love and affection from mom and dad, and from the 6 months, she's not getting same love and affection. So
Yeah.
she's trying to find out that particular love and affection from the schoolmate.
Exactly. Yes. Very good.
It's like now in this situation, sir, we need to give counseling for the mother, father, friend, as well as the school teacher, as well as the particular patient. As a whole, we need to give counseling for everyone. Sir, if I'm wrong, please correct me, sir.
It's correct. It's exactly your approach is exactly correct one. So here, see, it's a multiple issues are there in this multiple angles, multiple perspectives here. Got it? One is the child, that 14 years girl. She her issues is that her feeling is that her emotion is that maybe that after a long gap, some rival is there. That is sibling rival. Issue of sibling rival. Got it? Sibling rival means the
Yes, sir.
mother is conceiving after long time, around 13, 14 years long gap. She is conceiving. Her mother is conceiving. So this 14 years girl, she may feel that some sort of love and affection, maybe not up to
Some
the
kind
mark.
of jealousy towards that particular small kid. Her own sister.
Yes, jealousy. Yeah, of course, it is a jealousy issue. That is one. Second is, in order to get the love and affection, so from the parents, now she expects same means love and affection from the other sources, like boyfriend. Got it? So here again, see, we need to get the information, we need to get the knowledge of Abraham Maslow's hierarchy of needs. What is Abraham Maslow's second, that is third hierarchy of need means? First one is physiological need. Second one is
security need.
Need of love, the need of safety and security. Third one is need of love and affection.
Affiliation.
So this need of
affiliation.
That is the fourth one. Affiliation. Okay, of course, affiliation. So this need of love and affection, she may not be in a position to get from the parent. So in order to fulfill that particular need of love and affection or affiliation, so now she is not getting she's feeling that her expectation is that the same type of love from the parents, even in the 14th or 15th years also, even after some sibling in the family. Okay. So, but she feels that she is not having that much of love and affection from the parents. Now, in order to get the love and affection and affiliation from the family, now she is expecting from other sources like boyfriend. Yeah? Is it okay? That is number one. Number two, even the mother she is not as I mentioned, she is maybe she is experting in some other profession, or maybe she is literate or illiterate, I don't know. But she don't have this much of knowledge of our psychological issues. That is the reason she is in the stressful condition. Is it okay?
Okay, sir.
Yeah, it's fine.
So from the school, that is related, that is from parents and from the school related information, you have to get. But what I'm going to say is, in only one issue, see how many that is perspectives you have to see, how many angles you have to see. Whether the need fulfillment is perfect or not, is fulfillment is in a proper and systematic way. Any issue related to the emotions, so it is emotional issues also.
True.
Not fulfilling the need is one important aspect. We need to check, we need to verify, we need to know. Then second one is so jealous. With the example, so this is the way we have to give the counseling. Here is the whole problem of this particular case is adjustment with the family. Problem of adjustment with the family. Family of adjustment with the self. Sorry, adjustment with the self. Adjustment with the school authority. Or adjustment with the school environment. Okay. So this is the way of giving counseling to the adolescent issues, adolescent children, adjustment problem. Now, another last that is topic, that is unit 25, counseling to the disabled children, disabled people. What is meant by disabled? Abnormal or disabled? What is disabled?
It can be physical disability or mental low IQ.
See, physical disability or mental disability. Now the body is it's not increasing in our latest this one amendment is amended in the parliament. We are not supposed to use the word of disabled. Now,
Differently able.
challenged.
Differently able.
Differently able. Yeah, exactly.
Divyanga
Differently able. Yes, differently able. So
Physically or
how you
mentally
define
challenged?
mentally, physically challenged or differently abled? Then for this same thing here. So for example, the case of counseling to the different able child or mental retarded child. So how you define the mental retardment? How can you define it? What are the basis of mental retardment or physical retardment or physically challenged or mentally challenged? Or you can say these are the various disabilities. So based on some criteria, there is a criteria of defining or explaining about the disability, disabled or challenged. For example, if you want to explain about the mentally challenged child or mentally challenged person, based on the IQ level, intellectual quotient. So we know 90 to 110 is the normal IQ levels of any normal or average individual. Any person's normal IQ or average IQ is between 90 to 110. If it is above 110, it's above average, and above 120, it is gifted, so on, so on. Now it is below 90, up to the 70 to 90, the IQ levels are between 70 to 90. That is known as the borderline intelligence. You can't consider this borderline intelligence as a physically, mentally challenged person, even mentally challenged person or mentally retarded. And the second classification of below 70 is mild intelligence. Mild intelligence means 50 to 70, 50 to 69. I repeat, 90 to 110 is the average IQ level, normal IQ levels you can say. 70 to 90 is the borderline intelligence. Okay. Then 50 to 70 is the mild intelligence. Mild intelligence also not comes under the challenging person. This is a mild intelligence, mild intellectual or mild intellectual disability. Actually, mild intellectual people, that's it. Borderline intellectual people, average intelligence. Borderline intelligence, mild intelligence, average intelligence. Okay. Now, if it is below 50, IQ is below 50 or above 30, below 50 and above 35. These IQ, the children or persons having this level of IQ is called moderate intellectual disability, moderate intelligence, or MI, that is moderate intellectual person. So here the moderate intelligence this comes under the MR, or you can say mentally challenged. Then 35 below and above 20 is the severe intelligence, severe intellectual disability. Severe intellectual disability. Then last one is the below 20. IQ. The IQ is below 20 is the person's or individual's IQ is below 20. That is comes under the profound intellectual disability. Profound intellectual disabled people, profound intellectual disability, then severe intellectual disability, then moderate intellectual disability. Okay, these three categories are known as the mentally retarded, challenged, okay, or disabled people, mentally disabled. That is one category. Second category is the physical disability. In physical disability also there are different types. One is visual impairment, hearing impairment, multiple disabilities. Okay. So visual impairment means some sort of it is disables. You know, the sound is in disables. The units of sound. So based on that particular disability. So that is hearing impairment. Second one is the visual impairment. Okay. So visual impairment. Third is the multiple disabilities. Okay. So these are all the disabilities based on their physical aspects, like if there is any hearing impairment and visual impairment or multiple issues. Okay. These are all the broadly two categories. One is mentally retardedness. Second one is the physically challenged or disability. Okay. Now, what are the various methods of teaching these people? Okay, because see, mild and borderline people, mild and borderline issues are there. These individuals are trainable. These are also known as some sort of training to be given to these children or the individual, so that their level of intelligence can be, up to some extent, it can be improved, can be enhanced by providing some sort of training by the trained professionals. Trained professionals means, you know, there are some special educational methods, special training methods. So to provide the training to these children of mental retardedness and visual impairment, some sort of even hearing issues. So trained people are available. For example, DED special education, BED special education, MED special education. So these are the special educated people, special trained professionals. So through this special trained professional, we will provide some sort of training to these children or individuals. By providing the training method, training to these children, to these individuals, there is a chance of getting improvement in their level of understanding, the level of intelligence. Okay. For example, again, there are some stages of improving. For example, up to the age of 6 years, first level is from 0 to 6 years. There is a chance of improvement in this age group of 0 to 6 years. Number one, first level of improvement, first level of improving stage. Second is between the 6 to 16 years. the improvement will be fast in the previous first stage, that means 0 to 6 years stage. After 6 to 16 years, there is a problem, the possibility of improvement. The possibility of improvement is low compared to the first stage of 0 to 6 years. Third stage is after 16 years or after 18 years. So there is a chances are very less because already they attained the age of 16 or 18 years. So the development reaches its peak. Okay. So all developmental milestones or developmental characteristics, physiological, psychological, emotional or social also, reaches its maximum level up to the age of 16 or 18 years. Okay. You can observe any sort of developmental stages like Erikson's developmental stage or what is the cognitive developmental stage or psychosocial developmental stage of Erikson, psychosexual developmental stage of Sigmund Freud, and moral developmental stage of these are all the stages: moral developmental stage, Kohlberg's moral developmental stage, cognitive developmental stage of Jean Piaget, Erikson's or Sigmund Freud. Any developmental theories, they'll explain only up to the age of 16 or 8 years. For example, if you say the cognitive development, the final stage of cognitive development of formal developmental stage is up to age of 16 years. Even moral developmental stage of Kohlberg also. So up to 16 years, the moral development, fulfilled of moral development, it reaches its peak. Cognition also reaches its maximum level up to the age of 16. So here, what I mean to say is here, 16 or 18 years, up to 16 or 18 years, you can try to improve the intellectual aspect. But after that, it's not so easy to improve the intelligence of any individual person. Got it? Now, this type of training methods from the special trained people, you can provide training to these children of either mentally challenged or physically challenged people. Now, the other rehabilitation services are available. Rehabilitation services means providing training, providing the various devices. For example, if there is hearing impairment or visual impairment, even multiple disability also. From the government of India side or from the state government or state governments, they will provide some sort of rehabilitation facilities, rehabilitation services. Rehabilitation centers are available across the country or in some states. So those type of rehabilitation services you need to understand as a psychological professionals. Then you need to inform to those children or the families to use this type of rehabilitation services from the government side, from the non-government side. Some NGOs are providing rehabilitation services. Even government service also available. Some pension schemes are there to these children. Pensions are available. Some devices they will give, they will provide the devices like the hearing devices. Okay. So, for all these people, like mentally retarded people, physically challenged, hearing impairment, that is visual impairment children, and even multiple impairment children, multiple disability children. So, they will get some sort of assistance from the government side as well as the non-government side. These rehabilitation services and rehabilitation information of rehabilitation services you need to get, and you have to inform these facilities to the children of disability. Okay, and some sort of pensions are also available. For example, as I mentioned, based on their level of this disability, that is whether the acute issues are mild or moderate or severe, profound. Based on this disability, level of disability can say, the level of disability, they'll get the pension. For example, for the borderline case, they won't get any pension. Even for the mild case also, they won't get any pensions. The moderate and severe and profound cases, so some sort of 3,000, 4,000 monthly pensions, they will get. For example, in our state of Telangana and AP, even from Maharashtra also, they will get around 3,000 rupees pension per month. But these children, like profound, severe, and moderate disabilities. Number one. In Karnataka state, there's a different type of pension system there. Based on their level of, for example, if they got 50% of disability, they will provide some 1,500 per month like that. If the disability is 75%, so the 2,000 or 2,500, so they'll get the pension per month. If it is severity, 90%, there are different type of classifications. Classification means the 25% of disability, 50% of disability. For example, if it is a mental retardation or mentally challenged people, after assessing their IQ level, if the IQ is borderline, means only 25% disability. Borderline means 25% disability. Disability is only 25%. They are borderline intelligence people. If the mild intelligence means 50% disability. If it is moderate, 70% disability. If the if the intelligence is moderate,
Sir, your voice is not. Hello.
Is it not? Achha?
Sir, voice is breaking in between, sir. Sorry, sir.
Voice is breaking. Is it okay now?
Yes, sir. Thank you, sir.
Yeah. Yes. So these are the why I am explaining all these services, all these details means it's not mentioned in your book, but it is more important information. So as a psychological professional, when we are providing counseling services to these children, that is our prime responsibility to get the information to these children, no? At least from the families or the caregiver. Hello?
Yeah, that is true, sir.
Yeah. And even from the government of India side also, central government schemes are available. So pension schemes, along with the pension scheme, some sort of loans they'll provide. Some sort of loans means, for example, after some type of education, some basic type of education, if they get the challenged persons, they got some basic education like plus 2 or at least even SSC passed certificates. So some type of loans they will provide to these children. No need of paying total loan. Only 10% or 50% loans they need to pay. Rest of the 85% to 90%, they will like subsidize the type of loan. They will provide the loan. For example, they they issue 10 lakh loan to these children of challenged persons. Only 10%, that means out of 10 lakhs, they need to pay only 1.5 lakh, maximum 2 lakhs. Okay, the list of the knowledge, they will understanding based on intellectual issues. So they will give some sort of children, along with the child, some to be there in running that establishment or the business or any other industry. That is also other facilities from the government of India. Even in the examination system also, for example, they want to write examination. Okay, you know that some systems of open school system like National Institute of Open Schooling, NIOS, or National Open School System. In that NIOS, any sort of CBSE or ICSE examination, maybe the regular mode examination or maybe the distance mode type of examination. Yeah, the marks, the minimum marks, the basic eligibility criteria will be different compared to the normal children. For example, if the 35 marks is the pass marks to the normal children, in this case of disabled children, disabled child or students, some relaxation of their marks, even the time allotment also will be some sort of relaxation. For example, 3 hours time is allotted to the normal children. Some extra time will be allotted to this physically, mentally challenged if they want to attend the examination, if they want to write the examination. In all the CBSE boards, SSC boards, even ICSC, even any sort of, whether it's regular mode or maybe distance mode also. For example, National Institute of Open Schooling, the facilities, some different type of facilities will provide to this children of children. This all comes under the rehabilitation service, rehabilitation centers, rehabilitation services, facilities from the government side, facilities from the non-governmental organizations. Some non-governmental organizations also provide some sort of facilities to these children.
Sir, in the case of NIOS, there is a special facility also. That is normally up to high school, there is no choice of subjects for the students. But in the case of NIOS, they can choose, just like in graduation we choose. Suppose the people who fear mathematics, they can avoid mathematics and choose other subjects.
Yeah.
That is there in NIOS.
Yes, yes. Now the same choice-based credit system. Now you are talking about CBCS, choice-based credit system. Choice-based credit system, CBCS. Choice-based credit system is available in the recent times in the university. But NIOS system is not only now, even from last 10 years, 15 years, they have their system.
Yes.
No need of choosing only our traditional type of system. Like for example, in the +1, +2 in intermediate level, math, physics, chemistry, along with the English and the other second language, they are supposed to choose only these 3 subjects if they want to go for the MPC group, math, physics, chemistry only.
Exactly.
For BPC only biological studies, physics and chemistry. For TEC, commerce, economics and civics only. For HEC, history, economics. But whereas in NIOS, no such that restrictions. Any subject they can choose.
Oh, now in the new system?
Yes.
Okay. New education system, you mean?
There is no conventional system in NIOS. Like any sort of subjects.
NIOS, I'm aware of it.
Even now in some university, even Usman University, in other universities, even Central University also, CBC system, choice-based credit system.
Yeah, what I mean to say is, this choice-based credit system is already there in the universities and colleges level for so many years. But in the schooling system, only I think NIOS has it, to my knowledge.
Schooling, yeah, NIOS is in NIOS there are 3 categories. One is basic, up to 8th class, okay, without any knowledge, without any school background. The late examination, they will get the basic certificate, that means 8th class. Then second is secondary system, second is school certificate. Secondary school certificate means after completion of their that is like board examination of SSC, they'll get the secondary examination, secondary certificate. Another one is like +2, senior secondary examination. So in NIOS, these systems are there like basic level, secondary level, senior secondary level. On the subject, there are no restrictions of choosing the subject, any subject. For example, drawing also one subject there. Drawing.
Exactly.
Yeah, drawing. Along with other subjects. That is, if they want to choose, the drawing is one subject, they can choose the drawing is one subject.
That's very good.
Then data entry also one subject there. Data entry, only data entry, that's it. No. Data entry, drawing and other subjects. But only thing is very English, they need to choose English. And no other second language, no need of selecting the second language. Along with the English, other 4 subjects. Drawing is one subject, data entry is one subject. It's like that. Okay, no, this restrictions in
Compulsion.
choosing the subject.
Yeah,
No
restriction
compulsion.
or compulsion.
No, yeah, yes. Even in the SSC level, as we are talking about the graduation level. Graduation level now, some universities are introducing this type of CBCS system, choice-based grade system.
Yeah.
Now, in the NOVAs, you are right. You are talking about your information is that. So, in the NOVAs, not only now, in the previous last 10 to 15 years, SSC, even
I know
plus 2, even plus 2. Yes, sir, yes.
Yeah.
Okay. So, what I mean to say is, see, we need to, as the psychological professional, providing the counsel to the disabled child. These are all the information we need to get. We need to know all those facilities that are providing from the different organizations, like maybe government organizations or NGOs or any centers. So, these type of facilities, they are ready to provide. Only thing is, some of the disabled parents or the children, they don't know about these facilities, these rehabilitation services. So
Yeah,
that is
that
our prime
information
response.
also empowers us more for better counseling.
Yes, see, sir, counseling is nothing but empowerment. And in order to provide the counseling, we need to empower the person, empower the child, empower the individual. So in order to provide one sort of counseling to only one issue, that is the difference between the guidance and the counseling. Guidance is that effort. For every time they'll come to you, they will approach the psychologist or the counselor in order to resolve that issue. For example, the one issue is resolved, again they'll go, and again if there is any other issue raised, definitely they'll come to the same counselor and any other counselor. That is the guidance process. But whereas the counseling is not that process. Once they came to us, they approached us. In order to resolve those issues, we need to empower the person, so that in any other issue, they won't approach the counselor, they won't approach the psychologist. They will be in a position to resolve that issue, address those issues.
Yeah, that's right. We are not just solving the problem, but we are furnishing them a tool to empower them.
Yes. We are identifying, we ask them to
situation also.
Yes, exactly. So see, in Abraham Maslow's, even Carl Rogers' humanistic approach is that, no? So in order to, you identify the abilities, you identify the competencies of the individual, so you just show them. That means you are improving the insight of the client.
Exactly.
You are improving the introspection. Ask them to identify their own competencies.
Yeah.
So that they will utilize it.
Exactly.
For example, if your 100 rupees or 500 rupees in your pocket, first of all, we need to acknowledge the 500 rupees there in my pocket. Then only we will utilize, no?
Yeah, that's right.
Got it.
They are having it, but they are not realizing it.
They are not. So they need to realize it. 500 rupees is in my pocket. So the same thing. So even the challenging people also, you need to see the positive side of the challenging person. Of course, his visual impairment is there, hearing impairment is there. Just what about the other positives, other competencies?
Correct.
So we need to focus on those competencies, the other positive aspects, and we need to show them. And of course, you are the person facing this issue, but what about the other competencies?
Yes, then they feel empowered and act with confidence.
Exactly. That is our prime responsibility as a psychological counselor.
Yes.
And in order to explain all those things, we need to explain various facilities provided by the different organizations.
Yeah.
So that they are their family members. They will realize these are the facilities, why we are not utilizing, why we are not using it. Yes, and certification. Certification also another issue. Certification. So nowadays, providing counseling one aspect. So certification also important. So certification, they need to get that disability certificate from the authenticated these organizations. For example, some organization
medical board for that.
Medical board, medical boards will be there. Based on the medical boards, before that assessment part, directly medical board won't be. For example, there are medical professionals in the medical board. They won't assess. In the medical board, actually, we have psychiatry department, one professional from the psychiatry departments, one professional from the counseling side, means psychological side. Other are, for example, if it is hearing issue. So ENT, specialist will be there. ENT professional, ENT specialist, medical professional will be there in the board. Okay. Along with the ENT specialist, some of the that one person will be from the psychiatry background, and one person from the psychological professional side. Okay. So this medical board will provide the certificate to that
Certification.
disability.
The extent of disability they will certify.
Yes, they'll based on the assessment of the psychologist. Here, assessment, for example, disability is a mental disability. Definitely, they are not supposed to. They are not supposed to. Those medical professionals are not supposed to give the assessment. They are not administer the test. No, just they will. They are the professional. They are expert in their own. For example, ENT.
Okay.
So he is the medical professional. No.
That's
the
medical part he can certify. Yes.
Yes, the medical part of eye or ear, they'll check only that part.
Yes.
So rest of the IQ levels, rest of the part related to the intelligence, that is the role of the psychologist, the role of the psychological professionals is very important here.
Exactly.
Okay. So based on this report, based on his assessment, based on the psychologist assessment, that board of that medical board provide the certificate. So this certificate is, for example, if the child is around 6 years or 7 years of age, so this child of 6 or 7 years, they won't get the permanent certificate for this issue.
Okay.
The certificate will be issued only for 5 years. Okay, based on the age. After 16 years, the permanent certificate will be provided.
I see.
So there's no chance of improving after 3 years. As I mentioned, there are 3 levels: 6 years level, years.
Yes,
Then above 16 or 18 years. Once they attain the age of 16 or 18 years, then they'll get the so they'll get the permanent disability certificate. Okay.
Right.
So these are the various services, the rehabilitation procedures. Any doubts you can ask now. So, for examination point of view, I want to give you already are in second years now. You know the system of examination. There are two sections. Yes. 2 sections. First section is the essay type questions. From first to 8 questions are essay type questions. Okay, 1 to 8. Out of 8, you need to answer 4 questions. Each question
10 marks.
Carries 10 marks. 10 4s or 40 marks. That is the first section. Second section means from 9th question to 18th question, means 10 questions are the short answer questions. In these short answer questions, out of these 10, only 5 to be answered. 5 answers, you are supposed to answer 5 questions out of 10. Each question carries 6 marks. 5, 6 are 30.
Okay.
Okay. So total first section 40. Second section 30 marks, total 70 marks. Rest of the 30 marks is for assessment. This is examination pattern. You are all in the second year PD courses, so you know that the examination pattern. Okay. And one more suggestion I want to give. Of course, just only for few students, few candidates, they will their understanding is that the evaluators, they won't check the answers in a proper way. But definitely, as far as my subject is concerned, each and every answer will go in deeper manner. Then only we will allot the marks.
Okay.
Okay.
That's nice.
Yeah.
Because, just as the ultimate student valuation depends on his performance, I think a university's value is judged by how fairly and how correctly it is doing the valuation of the exam papers of the students. That's what I believe. That they have to take a lot of care. I don't know how much care they are taking, not in your subject, other subjects also. That they have to attend, they have to more carefully. That's what
you
I
mean
observed.
to say that care is not taken by the universities or evaluators?
I don't know because I can't comment on that. But what I observed is the valuation is not whether I can use the word or not, up to the mark in some cases at least, I felt.
Okay. See, there are two evaluations. No? First evaluation, okay. After that, second evaluation. You know about this type of procedure?
I know there's two valuations also.
First evaluation
what
is,
happens is, even in the case of two valuations also, if the valuation is following one type of way, then even the two valuations also may go wrong in some cases. So I don't know what are the systems for reviewing and ensuring the quality of valuation. I'm not aware of that, but my
just I will explain what is the system of valuation. Yeah, please tell me. Please,
my sincere suggestion is just review the valuation system, and in case there are any loopholes or something to be bridged, let them taken care of. That's all.
Okay. So here, valuation system is that, for example, first evaluator, they will evaluate the paper. For example, he's awarding a marks around 40 marks out of 70. Okay. Yeah. So the second evaluator, he don't know that she don't know about the first evaluator marks.
Right.
Okay. So he or she will complete her evaluation, and they will award the marks. They will give the marks. Okay. For example, the first evaluator marks 40. Second evaluation, after completion of second evaluation, for example, the marks are 30. The difference between the first evaluation and the second evaluation is 10 marks. If the 10 marks are the difference between first evaluation and second evaluation, then the average will be taken. 40 plus 30 by 2. That is means around 35 marks. This is the final marks of the candidate. That is the 35 marks.
Okay.
So if the difference between the first evaluation and the second evaluation is more than 10 marks, for example, the first evaluation marks is 40, the second evaluation is 25. So means difference is more than 10. So this is the more than 10 marks of the difference between the first evaluation, second evaluation. It will go to the third evaluation. The third evaluation may be within that universities. The third evaluation may be outside the university. Maybe some other university. They'll send the papers.
Okay.
So here, even every means this is a standardized procedure, no? What is wrong in this?
Yeah. That's good. That procedure is good. Very good.
Yeah, if they don't know, for example, I'm the evaluator, second evaluator, I don't know the first evaluator marks. What is the score in the first evaluator? I don't know. The scanned papers will be sent to me, no? We have our own, that is confidential systems, when passwords, everything is there. So I don't think any other means in this.
Okay.
So in the third evaluation means they'll send the papers to some other universities. Okay.
That's fair enough.
Yes. Anything else related to the examination point of view or in your subject point of
view? Subject-wise also very fine as far as your counseling psychology is concerned.
One more thing I want
all
to
the subjects.
See, it's a counseling means, as I already number of times I told you, it is a psychological. Please try to understand the counseling is not the elderly counseling. It's a psychological based counseling. Counselors are different. Psychological counselors are different.
Exactly.
Just today only examination. One example. When you are providing the counsel to the adolescent, you have to know what are the various issues related to the adolescent.
Exactly.
So direct counseling without proper knowledge of psychological theories or psychological principles, you can't give the proper counseling.
Yeah.
Okay, so the better
very
understanding.
Specific and issue based. Very specific and
issue based.
Issue focused. Yeah.
Issue focused, number one. Number two is based on the psychological, not our own experience. You give the counseling from our own experiences, from our own this perspective. That is not the psychological. It's the elderly counseling. That counseling is not work. It's only tentative solution. Provide the tentative solution, not permanent solution. Is not possible in such cases. Such type of counseling. Number one. Number two, the counseling. Just if you think that only one technique is enough in the particular case, no. Some combination of techniques you need to use. Just now I mentioned. one small issue of behavioral issue, one small issue of that is low performance of academic aspects. See how techniques we need to use. There are various techniques like cognitive. Why cognitive restriction? I mean, you are talking about somebody of some student from your class is talking about the parental acceptance, the issue of parental acceptance.
Exactly.
In that issue, ABC model and restructuring of state, that is thought process. CRT, then visualization, then the help of the Abraham Maslow's hierarchy of needs. See?
Yes,
See,
yes,
only
so
small
many
counseling.
things. Yeah.
Exactly. Yes, yes. Really, you will
That is
enjoy in the
combined
counseling, psychological counseling, if you use proper system.
Exactly.
Even the Egan's model also. Egan's model. In Egan's model, what in the Egan's model? First stage is this. Second stage is this. Third stage is this. Stages of counseling in the first stage of Egan's model. So rapport establishment, getting information. Okay. Then second stage of Egan's counseling is actual procedure. So by using various techniques, of counseling. Then how to sum up these issues? That is the last way up, and how to give the follow-ups. So see, in Egan's model, first stage model is Egan's model, but the first stage generally what we use again we will go to the Carl Rogers humanistic approach. Client-centered CCT, client-centered approach, client-centered technique, client-centered therapy. What is client-centered therapy? Again, model is again when you are providing different type of counseling methods, various stages, we will provide the stage-wise counseling. No, first stage, second stage. These stage-wise is from the Egan's model. Whereas when you are providing the counseling, what are the various techniques, various skills of counseling based on the Carl Rogers humanistic approach.
Yeah, right.
Like client-centered technique, client-centered approach, CCT.
Exactly.
Client-centered means again the same, listening skills, empathical understanding, genuinity, unconditional positive regard.
Yes.
So
really, it's a very highly interesting and challenging job, counseling.
yes. We actually, if you follow these all systems and techniques, we'll enjoy this counseling type of when we provide the counseling to this. See, medical professionals, they will suggest, they will advise, 10 grams of medicine, 25 grams of medicine, 100 grams of medicine. The dosage they will explain, they will give this type of dosage. The same way in the counseling psychology, psychological counseling, the word we are using, it itself is a dosage. It is a medicine.
Exactly. Depending on the level of difficulty or the problem, we use that relevant level of counseling and technique.
Relevant words, relevant sentence, relevant techniques we have.
Exactly.
See, even empathical understanding also, when you use some type of words, it itself is the empathy.
Exactly. Even non-verbal, just by sitting and
non-verbal cues,
touching.
your expressions, your touching,
everything counts.
Yes, everything counts. They're all like a medicine.
Yes.
Medical professionals provide the medicine, but whereas the psychological, suggesting medicines is not that much of hard, but providing counseling out of your experience, out of your subject knowledge, providing counseling is a professional.
That is true.
So keeping all these various issues, if you provide counseling, that will be a perfect counseling.
Yeah, perfect counseling.
So what are the steps involved in client-centered techniques?
Yeah, other techniques.
What all are there in client-centered techniques? You were just about to say something.
CCT, child-centered. You see, it is the child-centered is based on the humanistic approach of the Carl Rogers. So in the child-centered, self-realization, self-esteem, self-concept, self-awareness, self. Okay, so just self, as I mentioned, though they know though they have competencies, but they need to acknowledge, they need to realize these are my competence, these are my positives. So if they realize, that means you are getting self-awareness.
Okay.
After establishing rapport in the first section of counseling, so this type of self-awareness, ask them to identify this self, that is improving insight. Here, one method of psychology, some methods of psychology: introspection method, observation method, laboratory method, case study method, survey method. These are the various methods of psychology. Here, we use introspection method to improve their insight.
Yes.
Identify their own self. Insight means identify their own self. Nowadays, the problem is that so many people, they won't see their own self. They are always busy in observing
others.
Yes. So people are busy observing others.
Yes.
In
We want to know
observing others.
Yes,
except
exactly.
ourselves.
Yeah. Madam, tell me.
We want to know everyone except ourselves.
That is the issue. That's the problem. That is the reason they are not in a position to identify their own self. They are busy.
Exactly.
So here our prime response in CCT, child-centered therapy or client-centered therapy. So that is our way of giving counseling to identify their own self. That is improving insight. When this is nothing but empowerment of the person. They have their abilities, but they don't know. They are not aware of their abilities. So, the psychological professional, we will be in a position to identify, to improve that insight. Client-centered therapy, we know there is some directional counseling, non-directional, and eclectic counseling type of. It is non-directional. No need of giving any direction. Just ask them to identify their self. Awareness, create now self-awareness.
Yeah, exactly.
So other important skill is listening. Listening.
Skill.
Why listening?
That is the only way to know.
Yeah, nowadays, nowadays in a mechanical lifestyle, nobody is listening to other issues.
Yes, yes.
They are ready to talk. They are ready to give bhashan, but they don't know.
Yes.
They don't want to listen.
Everybody
Here, as a
is eager to
psychologist,
talk.
yes, to talk. Nowadays, talking power is needed, but no need of talking power in the psychological account. Just listening. Talking power is not. No need of talking power in this profession. Only issue is, the problem is listening. So the more we listen, the more we understand the client's issue. The more we listen, the more we assess the client. The more we listen, the more we give an opportunity to ventilate their emotions.
Yes.
So always try to listen.
And always try to make the client talk.
Yes. Let them talk. Let them ventilate. Let them express their emotions. Let them express their feelings. Once they express their emotions, some sort of relief they'll get. Because nobody is there to
very important.
Listen.
Yes.
Being a good listener as a psychologist, that is our responsibility, that is our duty to listen. So that they will have some sort of relief.
Yeah. Sometimes even that just listening will do the magic.
That's what, yeah. Yes.
And solve the problem.
It is, yeah. Even in listening also, as I mentioned, some micro skills. If it is one-to-one counseling, micro skills like solar skills, sitting position, openness, lean position, eye contact. Then this is known as micro skills of listening. Micro skills of listening.
Right.
Micro skills of listening means solar. S is sitting position, O is openness, L is lean position, E is eye contact, yes, lean. or is the relaxed? I am relaxed. I am here to listen you only.
Yes.
That is relaxed. If you are busy, how can they ventilate their emotions?
Exactly.
So this 45 minutes time, this 1 hour time is meant for you only, no other work.
Yes.
That means relax. So solar is the micro skills in listening. So even in the that is telephonic counseling, or maybe any it is online counseling also, there are some techniques like voice modulation. Okay.
Yes.
So these are all some sort of cues, some sort of expression, some sort of listening skills in counseling.
Exactly.
So that's it. Anything else?
Thank you very much, sir, for your valuable teachings and very professional way of exposing things. Very nice.
Thank you very much. Thank you very much.
Luck. Please try to follow these type of protocol system in the psychological counseling, so that
yes,
you will enjoy it in this profession.
Thank you so much, sir. Thank you very much, sir. Your sessions are really enjoyed and thoroughly learned new skills, and you were really an exemplary psychologist. Thank you very much. You have listened to all our questions, queries, and sometimes silly discussions also. And thanks for bearing with us. And it's really nice. Thank you, sir.
Any doubts you can ask. If not now, even after some days also. Whenever I am free, I'll try to clarify your doubts.
Sir, really we enjoyed counseling psychology, sir. We enjoyed so much, sir.
Because see, after completion of our PG studies, your PG course, counseling is a compulsory aspect in any type of. For example, if you want to become a clinical psychologist, education psychologist, or any type of even medical setups also, counseling is one important area, no?
Yes.
Any type of profession you want to enter after completion of a PG. So counseling is the most important area. It means important subject. Okay. Right. Thank you.
Thank you, sir. Thank you, sir.
Thank you.
Thank you.
Hello. Hello.
Yes.
Yeah. Do anyone noted down like what is micro skill solar full form?
Smart.
Micro skills. Open. Solar. Sir just mentioned solar. Right?
Solar. First letter. So S for smart.
Okay.
O for open.
Okay.
L for leaning.
Okay. Leaning. Okay.
That means a little leaning towards the client so that he gets an idea that we are showing interest in him.
Okay. Okay.
L, A. A and R. Something. What is that A? That we have to refer to the book.
Yeah. Okay.
A and R.
Okay. Okay. Eye contact, he said. Eye contact and listening skills. Okay.
Eye contact, E, na? There is E.
Yeah, E, but that's not there in solar. That's what I was just checking. Like he was about to tell, but in the discussion, he just missed.
Okay, A and R. R, I think he told what is that last one? Or actually, in our offline counseling class also, he told that.
Maybe in any of the YouTube videos we can find again, because it's not there in the readers. So what all the faculty is teaching.
Yeah.
Most of
Sometimes,
the
especially
concepts
our Raju sir teaches a lot many things out of our this thing actual material also.
Raju sir and lady, like before this like referral counseling.
It's not SOLAR, it is SOLER. Okay.
Okay, ER. So it's
ER.
eye contact. Okay, fine.
Eye contact.
Okay,
it's not
fine.
SOLAR, it's SOLAR.
What's R then?
R is to relax.
Relax. Okay, fine. Thank you.
R is relax. What for A? A for what?
It's not A she's
There is
telling,
no
it's
A.
E. I. Solar.
SOLER. Solar.
SOLER. Solar. Okay. Eye contact. And relax. Okay, fine.
Fine. Thank you. So looking forward for
Did you join the
continue.
revision? Isha, did you join the revision group?
Yeah, I joined.
Okay, fine.
If anyone has noted the notes and anything related to our subject, just post in that, right?
No, actually, revision group is something like that. We plan, like we prepare a lesson and do a revision. Any doubts in that? Like we will discuss about. We are going to discuss, suppose counseling psychology first 3 units. We are going to discuss. Any doubts in that? If somebody has a doubt, they can raise a question, and we can have a doubt clearing. Yeah.
Okay. So
that will
like beforehand, we'll just divide the lesson.
Yes. Like that, we can even finish up the portion. At the same time, we can touch all the topics. If I am myself, if I am if I stuck somewhere, you might be good at that, and you can unlock it. So that's how we have. That's the reason, purpose of revision group.
Okay.
So nobody is faculty over here. Everybody are learning from each other.
Yeah, definitely. Then any of these online classes have any notes or any important points, also just sharing that.
Yeah, certainly. Anybody miss, then we will share in that.
Fine. Okay. Because most of you, especially you and 3 of the students have noted down the points also, I guess.
Yesterday's class, Mr. GK has recorded in his cloud organizational behavior. I would request Mr. GK to share it in the group.
No, yesterday actually that recording is not in our thing. Actually, it is showing like that.
It's from admin only, but we can't do that.
We cannot record because today also I